Here's the voiceover script as continuous narration without scene numbers or section headers. Our minds are incredible, but sometimes they carry struggles we can't see from the outside. Millions of people live with mental health conditions every single day. So what do these conditions actually feel like? What's really going on inside? Today, we're breaking down some of the most common mental health conditions, simply and respectfully. No judgment, no stigma, just understanding. Let's begin. Depression isn't just feeling sad. It's a heavy, constant weight that doesn't easily lift. Simple things, getting out of bed, eating, even smiling, can feel exhausting. People with depression often lose interest in things they used to love. It can make someone feel isolated, even in a room full of people. But connection, even small moments, can make a real difference. Therapy, support, and sometimes medication can help lift that weight. Depression is treatable, and reaching out is a sign of strength, not weakness. Anxiety disorders bring constant worry, even when there's no clear danger. The heart races, the mind spirals, and the body feels on high alert. It can feel like 100 what-ifs running through your head at once. Even everyday situations can feel overwhelming or threatening. Breathing techniques and grounding exercises can help calm the nervous system. With therapy, like CBT, many people learn to manage anxiety effectively. Anxiety can be loud, but it doesn't have to control your life. Panic disorder brings sudden, intense waves of fear called panic attacks. The heart pounds, breathing gets fast, and it can feel like something is seriously wrong. Slow breathing and grounding techniques can help the body settle. Panic attacks are frightening, but they do pass. Talking to a professional helps people understand and manage these episodes. With the right tools, panic attacks become far less overwhelming over time. OCD involves unwanted, repeating thoughts called obsessions. To ease the anxiety these thoughts create, people often perform repeated actions called compulsions. This might look like repeated checking, cleaning, or arranging things a certain way. It's not about being neat. It's the mind trying to reduce intense anxiety. Therapy, especially a method called ERP, helps people gradually resist compulsions. Over time, the anxious urges lose their grip. OCD is manageable, and many people learn to live freely alongside it. Bipolar disorder causes intense shifts in mood, energy, and activity. During a manic phase, someone might feel extremely energetic, fast-talking, and confident. But this can shift into a depressive phase, low energy, sadness, and withdrawal. These shifts aren't a choice. They come from changes in brain chemistry. Understanding these patterns helps people recognize what's happening. With consistent treatment, therapy, and often medication, mood swings can be managed. Many people with bipolar disorder live full, stable, and balanced lives. PTSD can develop after a deeply distressing or frightening experience. It can cause flashbacks, heightened alertness, or strong reactions to reminders of the event. People with PTSD may feel on edge or avoid certain places, people, or situations. Talking with a trained professional creates a safe space to process these experiences. Grounding techniques help bring focus back to the present moment. With time and support, the nervous system can learn to feel safe again. Healing from PTSD is possible, and support makes a real difference. Schizophrenia affects how someone perceives reality, including thoughts, perception, and focus. It can involve hearing or sensing things others don't, called hallucinations. It may also involve strong beliefs that don't match reality, called delusions. With consistent treatment and medication, symptoms can be significantly managed. A strong support system makes a meaningful difference in daily life. Many people with schizophrenia lead structured, meaningful lives with the right care. It's a serious condition, but with support, stability is absolutely possible. ADHD affects focus, impulse control, and activity levels. Sitting still or staying on one task can feel incredibly difficult. Even simple to-do lists can feel overwhelming to manage. But breaking tasks into small steps can make a big difference. Interestingly, people with ADHD can experience intense focus on things they enjoy, called hyperfocus. Structure, support, and sometimes medication help manage day-to-day challenges. With the right strategies, ADHD minds can be incredibly creative and capable. Eating disorders involve a complicated relationship with food, body image, and control. They're not about vanity. They're often tied to deep emotional pain. Talking to a specialist creates a safe space to address what's underneath. Support from loved ones plays a powerful role in recovery. Healing is about rebuilding a healthy relationship with food and self. Recovery isn't linear, but it's absolutely possible with the right support. Borderline personality disorder involves intense emotions that can shift quickly. Relationships can feel especially intense, sometimes bringing a deep fear of abandonment. Therapy, especially DBT, helps people understand and regulate these emotional waves. Learning calming techniques helps create space between feeling and reacting. Over time, emotional responses can become steadier and easier to manage. With support, people with BPD can build stable, meaningful relationships. Autism is a different way of experiencing and processing the world, not a disorder to be fixed. Sounds, lights, or textures can feel much more intense for autistic individuals. Social situations may require more effort to navigate and interpret. Patience and clear communication make a big difference in connection. Many autistic individuals have deep, passionate interests and unique strengths. Acceptance and understanding help autistic individuals thrive as themselves. Every mental health condition is different, but they all deserve understanding, not judgment. Behind every diagnosis is a real person doing their best. If any of this felt familiar to you, please know you are not alone. Reaching out to a therapist or doctor is one of the strongest steps you can take. Understanding, patience, and support can change lives. Mental health matters just as much as physical health, always. Thanks for watching. Be kind to your mind, and be kind to others too.